Well, in terms of what those post-drug war models would look like, we're looking at the concept of regulation. We're very keen to distance ourselves from the sort of libertarian free market legalisation models that some people have expounded, although to be fair, relatively few. We're not talking about an unregulated free market free-for-all. And in some ways, part of the critique is that that's actually what we have now. There's very little or no regulation of drug products and drug markets now, because we've effectively abdicated all control to criminal entrepreneurs who are, only really respond to the laws of supply and demand. So what we're looking at is the kind of regulatory models that exist for risky products and risky behaviours in almost all other spheres of life, be that alcohol and tobacco, be that gambling, be that some forms of sex work or entertainment. And in fact, one of the things that seems clear is that regulating risky products and behaviours is actually one of the key roles of government, and they do that in almost all other spheres of life, and to a greater or less extent they do it reasonably well. There's certainly a well-established framework for doing that, and we've basically tried to translate some of that regulatory thinking into an area where traditionally or historically it's not been applied. So we're looking at regulating things like the products themselves in terms of dosage and packaging and pricing. We're looking at regulating the vendors who sells these things, licensing and training of these individuals to act as responsible gatekeepers to those markets. We're looking at regulating the outlets, so the shops or retail frontages, where they're located, hours of opening, their appearance, how they market and promote themselves or not. And then crucially, we're looking at availability. Who would be allowed access to these markets in terms of things like age controls or licensed membership or licensed access to markets. There's a whole range of different models that we explore in the Blueprint for Regulation. And then, having looked at that menu of options, the second half of the book is really looking at some models of how we might do that for different drugs. Now, clearly there's not a one-size-fits-all model. You'd need different levels of regulation, different intensities of regulation, depending on the product and where it was being available and to whom it was being made available. So the five basic models are a prescription model for the most dangerous drugs within a kind of medicalised model for dependent or more hardcore problematic users, various forms of licensed retailing, which is more familiar with off-licenses and tobacconists, although we're not suggesting that's an ideal model. Various forms of licensed premises for sale and consumption, like pubs or like cannabis coffee shops in the Netherlands, or unlicensed sales. So you'd effectively have the lowest risk products like coffee or sort of low strength caffeine products would be sold effectively like normal products in shops.